Could a routine doctor's visit be quietly putting your family at risk? Discover why even a short trip to the pediatrician might be more hazardous than you ever imagined, and what you can do to protect your loved ones. We're discussing all this and more on this episode of White Coat Wisdom. Welcome, everyone. We've got a lot of valuable information to cover today. My name is Dr. Ye, and I'm a board-certified pediatrician practicing in California for close to 20 years now, and my colleagues and I are starting this channel to share some pearls of wisdom and some valuable tips that they don't teach you in medical school. So stick with us. I think we're going to have a lot of fun, and hopefully we learn a lot together. Whether you're a parent, family member, medical student, fellow clinician, or simply a curious learner, our goal is to offer clarity, honesty, and humility in a field that demands all three. Before we get into it, if you haven't already, please like and subscribe, and be sure to hit that notification bell. We're just getting started, and your support really helps us keep making these videos. And if you find some information to be useful, please share this video with a close friend or family member, or with someone who cares about their health as much as you do. We encourage everyone to join us as we explore what it really means to practice medicine, not just study it. All right, let's get on to it. Imagine, you're sitting in the exam room at the pediatrician's office for your children's appointments. It's near the beginning of a new calendar year, so you've got your hands full, filling out a multiple-page stack of paperwork about your demographics and health history that the front desk gave you, while you patiently wait for your provider to walk into the room to begin the visit. Your young kids are bounding with energy, as young kids tend to be. They're jumping on and off the exam table and springing off the walls. They are constantly in motion, which of course is natural. Your kids might ask you to grab some exam gloves, either for them to put on or for you to blow up into glove balloons that they can volley into the air. They spin on the rolling stool, giggling uncontrollably, not realizing that the last child to sit there coughed so hard he threw up. The children drool, they sneeze, they pick their noses and then wipe their hands off on their clothes, as well as on the furniture and countertops. Basically, whatever's nearby. You hear the crunch of Cheerios underfoot as tiny fingers grab more from snack bags, some tossed to the ground, others scooped back up and eaten without a second thought. Sometimes they pick their food items back up and eat them. Or other times, they find entirely new food items on the floor and eat those. All the while, the kids frolic and roll about on the floor surface. But here's the part many parents overlook. Try to imagine all the young children who were in the room before your family.
Just as active, just as messy, and just as drooly, doing the exact same things before your family got there. Of course, medical staff will do some cleaning after each patient as they turn the rooms over, but it's a relatively quick clean. It's not feasible to do a meticulous scrub down between each and every family. Often the process involves spritzing plumes of Lysol disinfectant into the room air and then changing the exam table paper. When applicable, the staff will clean up any gross soiling that the room may have sustained, such as emesis or vomit, or any obvious food particles on the floor. Several scholarly articles have been written looking into just how adequately healthcare facilities are being properly cleaned and disinfected between patients. And while these studies focused largely on the hospital setting, the studies have unfortunately yielded less than ideal results on a consistent basis. This is concerning, and you should be aware of it. What's more, understand that children are often brought to the doctor's office with contagious illnesses, and you might well be aware the most effective vehicles of human disease transmission is other humans. This is particularly true with children. Young children tend to be especially inconsistent in covering their mouths when they cough or sneeze. Their droplets and mucus secretions routinely get sprayed onto room fixtures and other surfaces, especially when their attention is fixated on tasks of interest. Children can also vomit in exam rooms for a variety of reasons. Young children often exhibit stranger anxiety between 9 months of age to about 3 or 4 years of age. This is, of course, perfectly natural and represents an important phase of development. It's actually a very beneficial thing for kids to display this behavior, as it reflects a naturally protective reflex. Sometimes,
Kids can get so worked up during the process of an exam that they inadvertently trigger their gag reflexes, leading to them throwing up. Other times, kids can cough to the point that the coughing itself sets off the gag reflex. Children, by and large, have more sensitive gag reflexes than adults. This stuff happens. Other children may come to the doctor's office for evaluation of gastrointestinal or GI-related issues, such as acute gastritis or food poisoning, or even appendicitis, which is a true medical emergency. On the other hand, it's also possible that patients before you may have had dangerous skin diseases. This could include germs like MRSA, methicillin-resistant Staphylococcus aureus, a highly contagious and highly virulent bacteria. Or maybe they had warts, lice, ringworm, even obscure parasitic infections, the kind of invisible invaders you'd never guess were lingering in plain sight. Or any number of other ailments that are characterized by their ability to invade the human body. The reality is that the possible maladies and exposures one might encounter at a medical facility are practically endless. Of course, if any kinds of significantly dangerous or highly transmissible disease entities outside of the norm were brought into an office, appropriate measures would be followed. This might include closing the index case's room for the rest of the day until the after-hours cleaning crew has a chance to rigorously sanitize the area. The important point here is not to be frightened or grossed out, but to be cognizant and prepared. Parents are usually pretty intuitive about avoiding emergency departments for these reasons. And, for the same reasons, I recommend not getting too comfortable at doctor's offices. Try to resist lounging on the office chair or sofa or leaning against countertops. Don't allow your kids to eat anything that falls onto the floor. Maybe bring your own writing instrument instead of using the office's communal pens. Generally, try not to touch anything that you don't have to. Remember that the medical office is a public workplace, not a home. Germs abound everywhere, and you simply don't know what medical diseases were in the room before you. There's no way to tell. You just want to understand and respect the gravity of the environment you are entering anytime you step foot in a professional medical facility. Don't leave your doctor's office without thoroughly washing your hands and those of your family members. Similarly, if your children like to play with the toys in the waiting room, clean their hands afterwards. It might also be a thoughtful courtesy to consider washing or cleaning your children's hands prior to having them play with the office toys. Every step to limit the spread of germs can be helpful. As a quick aside about waiting rooms, don't forget that some doctors' offices feature 2 waiting rooms, one for sick visits and one for well visits. Take advantage of this option if it is available to you. Every exam room tells a story. Just make sure your family's chapter doesn't begin with an invisible enemy. That's our episode for today. Everyone, be sure to check out our other videos packed with real-world clinical insights. We're board-certified medical providers with over 30 years of combined experience, sharing the pearls, caveats, and hard-won lessons that only come from caring for real people, not just studying the books. Thanks for joining us here at White Coat Wisdom, where clinical experience meets everyday life. If you found today's insights helpful, don't forget to like, subscribe, and share this with someone who cares about their health as much as you do. Your support helps us keep bringing trusted, real-world medical guidance straight to you. See you in the next one. Until next time, everyone stay safe and stay healthy.
Welcome everyone. We've got a lot of valuable information to cover today. My name is Dr. Ye, and I'm a board-certified pediatrician practicing in California for close to 20 years now. And my colleagues and I are starting this channel to share some pearls of wisdom and some valuable tips that they don't teach you in medical school. So stick with us. I think we're gonna have a lot of fun and hopefully we learn a lot together. Whether you're a parent, family member, medical student, fellow clinician, or a simply curious learner, our goal is to offer clarity, honesty, and humility in a field that demands all three. Before we get into it, if you haven't already, please like and subscribe, and be sure to hit that notification bell. We're just getting started, and your support really helps us keep making these videos. And if you find some information to be useful, please share this video with a close friend or family member, or with someone who cares about their health as much as you do. We encourage everyone to join us as we explore what it really means to practice medicine, not just study it.